Hello, my name's Palejwala. I'm a gastroenterologist here at Burton Hospital. I'd like to thank Yazdan for giving me this opportunity to talk about gastroenterology and why somebody may, as a junior doctor, may want to go into gastroenterology as a career. To start off with, I'll just tell you a little bit about myself. So I qualified in '91. Did my training in Liverpool, did all my SHO registrar training there, and then in 2001 moved to the Midlands as a consultant gastroenterologist. 2004 started work here at Burton Hospital. So at Burton we are all general gastroenterologists, so there's no specialisation. So we tend to deal with a whole host of GI conditions. The reason I'm mentioning that is one of the questions people ask is, well, why gastroenterology? So I think the appeal about gastroenterology is that it involves a lot of systems, a lot of organs. The alimentary tract starts off at the mouth, goes all the way down to the anus. So in working its way down, you have to be aware of all the possible differential conditions that can mimic GI conditions, so GI problems. So you have to know a bit about oral pathology, you have to know a bit about chest pathology, you have to know a bit about abdominal pathology and pelvic pathology. So we often get referrals from the maxillofacial oral surgeons about people with mouth ulcers because it's Crohn's disease. We get referrals from the chest physicians and cardiologists because of non-cardiac chest pain. We get referrals from the surgeons because it's a cause of abdominal pain which is not surgical, and gynecologists because it's pelvic pain which is not gynecological. So we have to know all that. So we're very much generalists. Saying that though, in gastroenterology now there's, as I said, a lot of subspecialisation. So in gastroenterology you can become what's called a hepatologist, where you just look after liver conditions. You can become a hollow organ specialist, so that tends to be things like inflammatory bowel disease and nutrition. You can even become a pure therapeutic endoscopist, where you just do endoscopies all day. So it is changing slightly, but I'm more of an old-fashioned gastroenterologist, so it tends to do a bit of everything. What makes a good gastroenterologist, or what appeals to me to become a gastroenterologist, was you get the chance to do things. So you get to do things with your hands. So you get to do endoscopy, things like gastroscopy, colonoscopy. You also are a little bit of a surgeon because you can do things like polypectomies, ERCP. You can deal with gallstones. There's a lot of cancer work involved as well, so even though it's not treatment of cancer per se, it is the diagnosis of cancer. So again, with things like endoscopy, gastroscopy, colonoscopy, those things. I think to be a good gastroenterologist, I think you have to have some good hand-eye coordination, because it does involve therapeutic procedures. So what I do say to people wanting to train, even though it doesn't stop you, is if you are good with your hands, I think it is of benefit. The other thing is you have to be quite level-headed, because you're choosing a career where there's a lot of bleeding and there's a lot of poo. Okay, and some people don't like the mixture of those two things. And again, you have to keep a cool head, because if you're doing endoscopy, you're dealing with ulcer bleeds, variceal bleeds. You're the one that the nurses turn to keep calm and to deal with the situation. So I think you have to be somebody who is good at working under stress. Because if you're not, then I think that maybe you should be choosing non-therapeutic specialities. Okay. So that's what I think makes a good gastroenterologist. What about the training that you have to have? So I think it's changing now, but I think it is very much FY1, FY2. Then you get onto I think it's the IMT and then the ST training, because now it's more of a fixed program. I think what tends to happen is that with your ST training, the last couple of years, you then can specialise into which field of gastroenterology you want to go to. So I think you can become a fellow in endoscopy or in ERCP or in nutrition or in hepatobiliary work. Again, during that time period, you also have a period of research if you wish to pursue academia. So that's the other thing you can do. So that's the training. Whether you choose gastroenterology or any other hospital career, I think you have to be aware of the hours. And whilst you're training, you will be asked to do a week of nights. You'll be asked to do, the on-call where you're working 12-hour shifts. And I think you have to then balance work with family commitments. But if it's something that you enjoy, then hopefully the light at the end of the tunnel is that once you're through that, you can then start to enjoy the family life as well. But you have to be aware it is hard going. And as I'm sure a lot of the junior doctors will know, there's a lot of new stresses that are now there that weren't there before. There's sometimes less doctors to look after patients. The number of admissions are going up. The type of patients are changing. So in my day, you may get an 80-year-old who just had a chest infection, but now it'll be the 80-year-old who has multiple comorbidities. So you have to be aware of that. Would I tell a junior doctor to do anything different? Would I do anything different? I think you have to ask yourself, what is it that you enjoy? Do you enjoy hospital medicine, or do you prefer some of the other specialities like what's the other ones I'm thinking of? Public health, those types of things. If it's hospital medicine or GP, if it's hospital medicine that you enjoy, then you have to choose which speciality. Is it things like radiology, pathology, surgery, medicine? What do you like doing? And then you hopefully just chase your goals. What are the benefits? I think that so it depends on which field of medicine you go into, but there are some fields where there is benefit in terms of monetary benefit. So if you're an orthopedic surgeon, you will earn a lot of money. Okay, if you are a dermatologist, then there may not be that much scheme for private work. But the benefits is you get patients who will then say to you afterwards, thank you so much for looking after me. You get colleagues who will then say to you, I'm so glad I referred my case to you because I know that the patients will be in safe hands. So those sorts of things. And every now and then you get patients who drop you a line and they say, thank you so much for looking after me or looking after my mother or my father. So those benefits are there. And, even though I've mentioned financial incentives at the beginning, it's not all about money, because if it was all about money, then really you'd be better off becoming a merchant banker or becoming an accountant or a lawyer or something else. And we do get some mature students who were merchant bankers and lawyers who say that they didn't like the all the things that went with that, and they would not prefer to do something where they get they see the benefits and they get much more pleasure in doing looking after people, looking after the medical side of things, and they get more from that. That's the point I'm trying to make. Is there anything else to add? Again, I think whatever career you choose, I think you just have to be sure that it's something that you want to do, because you will be doing it for quite a long time. And if you're not happy doing it, then at an early stage, just reevaluate. And whether it's GP, whether it's hospital, my advice is make sure that you do something that you enjoy. If you enjoy family life, then I think then you should think long and hard about the hours involved, and maybe something like general practice is not a bad option. But again, you have to want to do general practice. You shouldn't be doing it as a second line, because you can't do what you want to do. So that's my advice to you all. Okay, and I hope you choose gastroenterology. Okay, thank you.